I'm Heidi Clavin. I'm here from Austin, Texas, working for Dr. McGrath Medical, and just started using the Lapex 2000 LipoLaser about a month ago, and we've had some really great success with it with our patients. And we had been using the Zerona previously. The thing that I really like about the Lapex 2000 is that we are able to spot treat and go after those targeted areas that are difficult. Because with the Zerona, we were measuring all over and losing in their arms when they didn't need to lose in their arms. They wanted their gut taken care of, and this specifically handles it, and I love it. I always re-measure because I'm always just blown away each time when I see it, and I'm like, oh my gosh, you just lost 2 inches on your waist. So it's very exciting. I feel excited about it, and so it's easy to sell. It sells itself. Really.
So you used the Zerona before. So tell me about what the differences are. What do you feel between the two machines?
I just feel like this just kind of takes it just solves the problem as far as targeting a specific area, and it's easy. It's a no-brainer. I go after the spot that they want, and where with Zerona it was always a guess to me where I'm going to be going, where they're going to hit, and I would always feel nervous because they would say, oh, I just want my tummy or my thighs, and I would just like, okay, let's hope it goes off of there. And oftentimes it would be their neck when they already had a skinny neck or skinny arms. And so this kind of just takes the anxiety out of my job, and because I know I'm going to see a result in the place that I place the panels on.
And I noticed you're wearing a stopwatch.
I am.
What is the stopwatch for?
It means I need to go change the panels on my patient every 10 minutes. I go, and when I'm doing a treatment, I do the target area 10 minutes and move it around, adjust it for 40 to 60 minutes, and it's time for me to get up and do that. Really like that job. Really like that job. But I love it. It's great. It's been fun to see the results. And I think it's just getting better and better, and people are coming in and wanting to do it. You know, I have patients that are on their second session now because they were so thrilled with the first results, and they just want to keep going. So I think we're going to be seeing a lot of that, a lot of people coming in for maintenance and, doing it twice a year because it's easy. It's very easy.
So selling the machine has been pretty easy?
Yes. I have my folder with the information from Meridian, how it works, and I have before and after pictures, and it just sells itself. It's just a matter of knowing how to describe what happens to the fat cell and what happens with the glycerin and the free fatty acids and the water, and what you need to do outside of this treatment to help promote this fat loss. So
how long have you guys had the laser?
We've had it almost a month now.
Okay, so you guys had it almost a month. And how many patients have you sold in the month?
Gosh, I would say about 20. I'm right at about 20 right now, and that's without even really advertising. That's just with people who are doing Zerona that I wanted to switch over from Zerona. And so once we have it down, we feel like we can really push it. My hours already, I'm coming in at 6:45 in the morning because I'm having customers that are so anxious to do it, and that's when I can do it. So
that's fantastic.
Yeah.